We're live.
What?
We're live.
Not right now?
Yeah.
Oh, okay. I'm Jose Serrano's news reporter and TSA official at Vista Lago. Um, there's been an Ebola virus outbreak in Liberia and Sierra Leone and has recently spread to Nigeria through a traveler. Most of these places have given an alert +2 level notices for traveling. And to figure out how to stop this outbreak, we must first out how it's been dealt with in the past. I'm accompanied over here with Ebola historian Pedro Menarez.
Thank you, Jose. First of all, the Ebola virus is spreading all over Africa.
How does it spread?
Usually spreads through animal to human, the native pests to human contact.
Who is this host said to be?
The host was said to be a fruit bat of the bacterial body thing.
Oh, is there a treatment?
Word has it that there is no vaccine or treatment for the Ebola virus, just good care for the patient. There is a vaccine being tested, but none have worked so far.
Interesting. What about the signs and symptoms of the Ebola virus?
The signs and symptoms of the Ebola virus is high fever, headache, sore throat, and weakness of the body.
How do you avoid getting this virus?
To avoid this virus, try avoiding fruit bats, monkeys, and leaves, and not eat raw meat and anything from the wildlife. And do not get close to an affected human if you do.
Thank you, Pedro. As you can see, the Ebola outbreak has been a huge epidemic around the globe. Now I'm joined with the World Organization doctor, Ms. Andrea Jimenez. Hi, Andrea. Can you tell me about this Ebola virus?
Yes. Ebola is a rare but deadly virus that causes uncontrollable bleeding inside and outside the body. This virus spreads throughout the body and damages the immune system and organs.
Since Ebola is a deadly virus, how do we manage to not catch this virus?
But even though it is a deadly virus, it is not as contagious as other common viruses. You won't be able to get it from the air, water, or food. To prevent getting this virus, do not touch the skin or bodily fluids of an infected animal or person.
What about the treatment to this virus?
So far, as we know, there is no treatment yet. There is some recommended care. The recommended care is to keep maintenance of blood pressure and the oxygen status of the patient. The patient should have controlled nutritional support, balanced electrolytes and fluids, and should be treated with secondary bacterial infections.
And as to the virus having an outbreak in the United States,
There should be no outbreak of Ebola virus here in the United States. The CDC says there is no risk for Ebola.
thank you, Andrea. Now we're going to talk about the huge death rates that this Ebola virus has taken in the Liberia and Sierra Leone and Nigeria.
Death rate for Ebola disease is now up to 90%. More and more people are dying each day. On August 14th through 16th, Liberia recorded 53 new deaths. The Ebola disease killed another 84 in West Africa over a 3-day period. The virus has been spreading like wildfire. There have been more than 2,200 deaths since the discovery of Ebola. Though some people who become sick with Ebola HF are able to recover, others do not. Healthcare workers are trying their best to find a cure for the Ebola disease. Currently, all cases of illness or death have occurred in Africa. Nothing has been
Now we're
reported
going to talk
in
to
the
the
United
handsome, very smart, intelligent, and amazing Jose Sobranes, the TSA official of the Ebola outbreak. Thank you, Jose Sobranes. So, since I am TSA official, my duty is to tell you whether I feel if, like the whole plane should be traveling from the USA, in places like Nigeria, Liberia, Sierra Leone. And in my opinion, I think it is safer for the American citizens to not have access to those places because once they come, more outbreaks start. And we are trying to keep the outbreaks at a bare minimum. So in my opinion, we should keep US citizens and the citizens of Sierra Leone, Nigeria, and Liberia isolated from each other. But of course, with regards of our doctors still going and our scientists still trying to help them out. Best way to do it is just, go and have a meeting with as many big airlines as you can and the only airlines flying over there. In my opinion, that would probably be the best and most successful plan for the airports and for the safety of the US citizen.